Hey guys, it's Dr. Justin Marchegiani here. We are bringing you hysteria-free information regarding coronavirus updates. Really excited. Today is March 25th, so just kind of keep that as in context of kind of where we're at from a statistics standpoint. So what's going on? Before we dive in, smash that like button. Love to see comments down below what you guys think. Any of you guys have gotten sick or have immune issues, let me know about it. Really curious. And also we'll talk about natural strategies. Done a compendium of these videos over the last couple of weeks, so feel free to reference back to old videos to get more good intel on things like good diet, lifestyle, immune boosting tips and tricks to help improve your health. All right, so let's dive into hysteria-free statistics. We'll do the hysteria-based math and the real math, okay? And we'll kind of look at it and compare and contrast. So here we have hysteria-based math for the United States. We have currently 61,000 cases. And again, I'm pulling this data from the WHO website, which is from worldometers.info, and they pull from WHO. So here are all the stats. And if you click on each country, you can actually get statistics for each country. So if you click on United States, here's 61,000 cases and 841 deaths. That's where I'm getting the data from. And I just keep this in a Google Excel sheet so we can track everything. So 61,000 cases, 841 deaths. That's a mortality rate, guess what, of 1.38%. So remember the WHO, World Health Organization, said they were going to be a mortality of 3.4. So we're already about 2.5x below WHO estimates. Just keep that in the back of your head. Now we go and do the real math. So first off, we have our cases, 61,000. We have our deaths, 841. Same mortality rate. The difference is people are projected anywhere between an 86% asymptomatic rate, which is about a 7.1, meaning for every one person that's sick, 7.1 people have the virus but show no symptoms. And this is supported by data, just so you know here. So here's the article on this. We estimate 86% of all infections were undocumented. That means you have the infection but show no symptoms. And this is in regarding to the coronavirus. So keep that in the back of your head. And then once we figure out the 10, some doctors like Dr. Schubel here up in Canada, he says it's the 20x marker. For every one person that has it, 20 people don't have it, don't have symptoms, but have the actual antibodies and the actual virus. Keep that in the back of your head. So we're running between the 86% and the 10x. So for every one person, so like a 1% is for every 100 people that have it, one person dies. But the problem is for every 100 people, there's another 1,000 that have it and are experiencing no symptoms. So keep that back of your head. We don't have the greater incidence, and that's why the hysteria math is so easy, because the real math tends to come after the fact, okay? So after pandemics like swine flu, the CDC or the World Health Organization realized that they were off by 63x, and they had to revise it. The problem is that they revise it years later and no one really cares. Like, you know, when we come back and revise this stuff in 2023, no one's going to be caring that much. We're over it, right? So I want to make sure that you guys understand why the real math isn't quite the real math today. It requires a little bit of what's called statistical regression analysis, and you need a large sample base to do that truly accurately. And I'll show you what I mean. So this is the real math down here, and then when you look at the 10x asymptomatic, we're down to 0.14, all right? 0.14, and then 86%, we're down to 0.23. So that's 24.69 or 14.77 times lower than the WHO, World Health Organization's original estimate. So you can see why the hysteria is happening. Same thing with the hysteria math in the world, right? 445,000 people passed. Cases, 20,547 in regards to the deaths. 4.61%. This is really inflated because of countries like Iran, Italy, and Spain that were hit really hard, partly because they didn't block travel from China soon enough, and also a lot of multi-generational households, parents, grandparents, a lot of smoking in those countries, so weaker lungs, a lot of elderly population, you're more susceptible. Now the real world math is the same, 445, 20,000 deaths, 4.61%. Now we factor in the 10%, the 10 times asymptomatic rate, or the 86%, right? Now we're down to 0.46 or 0.69. So you can see here now we're 7.3 to 4.9 lower than the WHO. So part of the reason why all of our economy and everything's all shut off is because of, my opinion, people freaking out a little bit too soon and not having good data. The 3.4% is part of what drove everything. So now the economy shut down. Other countries didn't shut down fully. You have countries like South Korea that did an amazing job. They didn't shut down. Why didn't they shut down? Because they did common sense, right? They did quarantined all sick, immunocompromised, and elderly. They did social distancing, but they kept the economy open, relatively speaking. So either way, here's where we're at now. So I still think quarantining and all that's good. We're here. Let's make the best of it. We're trying to flatten the curve, right? Here's the curve that we always talk about, we hear about, right? Here are the cases. Here's the hospital's capacity, right? So the goal is that we keep this loop here, this hump, beneath the healthcare system capacity so we don't get overwhelmed. And again, I don't think the capacity is going to be tapped overall. I think in certain key areas, when we go look at the data, that's where we're going to see the capacity, right? So we look at total deaths. Let's go to the U.S. to be more specific. Let me go to the U.S. Let me get that lined up here. So let's go to the U.S. and let's sort by total deaths. So the places that are going to get overwhelmed are going to be like New York, Washington State, Seattle, New York City. Those are going to be the places that be more overwhelmed. I don't foresee other places here. I don't see 2,000 total cases overwhelming California unless they're in one region. New York, 30,000 cases. Yeah, definitely be overwhelming New York City for sure because of how concentrated it is. Same with Washington State. That was primarily a quarter of those was from one nursing home. FYI, keep that in the back of your head. So hope that makes sense. And so we go back to the Hysteria math here. I want you guys to understand. Let's compare it to flu. So 230,000 cases are confirmed a year of flu. 23,000 die. If we run Hysteria math, guess what? We get a 10% mortality rate. 10%, right? Pretty simple. 23,000 divided by 230,000. Now, we have to conduct about 1.2 million tests on the flu to get this bigger number. So when we run the regression analysis, we know there's about 23 million cases of flu. According to the CDC, it's about 23 to 36 million per year. So you can see here's the data on the flu. Here, this is 2019, right? So 35 million, and we had about 34,000 deaths. It's about a 10% ratio. So about a 0.1% ratio. So whatever the bigger number is, 35 million, it's about 0.1% of that, which is 35,000 is the death rate. The average flu death rate over the course of 100 years is about 36,000. So when we run the actual regression analysis, we figure out how many tests were done here, 1.2 million. We figure out how many overall cases we're at. That's how we get to about 0.1%. But if we run Hysteria math, we only get 10%, right? We do 23,000 deaths divided by 230, and then we get the 10% rate. So not quite like that. So they're running the Hysteria math for the flu. We think flu is killing 10%, which is actually far more than what we see with coronavirus. And we're not shutting down the economy with flu, are we? All right, hope that makes sense. So let me kind of look at a little bit of the data here. So here's our overall death rate for today across the whole country. Let's look at the trends. The trends are what helps us. Actually, before we do, a couple things I want to highlight. I'm not sure if you guys heard of this before, but we had this number. It was called R0 or R0. This is like our contagion number. This is how contagious the disease is. They said COVID was between 2 to 3.1, okay? So that's like so for one person that gets it, they can give it to 2 to 2.3 people, right? That's how infectious it is. So you can see measles is pretty infectious. You can see HIV infectious, norovirus, but then look at seasonal flu. So they were kind of saying, look, COVID's 2 to 3.11, and look at flu. It's not even close. This is so much more infectious, but they underestimated this. And part of the reason why is because if you don't know the total number of cases, right? If you don't get the total number of cases, right, because it's probably 10x more, you can't accurately calculate that number. So what they're actually finding, this 2 to 3.1 number, this R0 number, check out this study I found this morning. Where is it? Oh, I had it already highlighted here for y'all. Let me find it. It is... Here it is. And the enhanced public health intervention after January 23rd was associated with the decline at their R0 at 5.8. So what they found was this article was a peer-reviewed study looking at the epidemiological assessment of the transmission of coronavirus in China. So they looked at China between January and February, which is where the the outbreak really happened, right? So here's the outbreak from January all through February, right? Remember, it dropped off March 1st. So this was the core of where the outbreak was at, just to kind of give you guys a frame of reference. And they found that R naught score, right? This is the how infectious it is, actually declined to 0.58. So now we go back to this little article here. Wait, they said 2 to 3.1. So we're actually 0.58 puts us actually well beneath the flu, because the flu's at 1.3. So it's actually well under 50% below where the flu is. So, and again, this is where the hysteria starts. So we have the advantage of looking back. So you can look at some of the infectious numbers. The R naught or the R0 number was way higher in the beginning. Now they're revising it. You can look at some of the hysteria math versus the real math. Part of that is people are not getting the asymptomatic number of people. And again, about 500,000 people go to the hospital a year, and we only have about, in the U.S., we only have about, we look at the cases, we have about 61,000 cases, and only 20% of those are being hospitalized because 80% are mild. So keep that in the back of your head. All right, let's look at the rest of the data and see what's going on. So here's the trends in the United States. I think we're just at that flat line. So you can see the curve here, or the angle for new cases, is starting to peter out. We're at 11,000, meaning it's starting to flatline. It's still up a little bit, but we're right at that curve. And again, the curve that I'm talking about is there's a natural bell curve that a virus has to go through. This virus seems to be about 2 months. You can see right at the top is where it starts to peter out and flatline. We have a natural curve that the flu goes through as well. Here's the bell curve of the flu. So you can see viruses and infections tend to have this curve. So if you just look at cases and throwing at you one by one, and you don't look at the bigger picture, it's easy to get overwhelmed. So here are the new cases. They're starting to peter out a little bit. And then here are the deaths down below. We'll have to keep an eye on this. Let me see. Is this United States? Yeah, this is U.S. So March 24th, so 225. So we're getting ready to round the top. There's a lag, right? So the reason why a lot of these cases went up so fast is because we just didn't have testing. And so we had this huge pent-up demand for testing, meaning everyone's like, I need to get tested, I need to get tested. No tests available. Now tests are available. So there's a big flooding of the zone with all these tests. So this will peter out in the next week, because it takes about 2 to 4 days for the test to complete. So we'll get this. These cases should start to drop. We look in countries like Italy, where we were really like having a lot of concern last week. I mean, look at the cases, right? They're actually dropping. Look at that. It's following that beautiful bell curve with the cases, and then the deaths are going to be a couple weeks behind. And the deaths are already following down here as we speak. And currently 743 we were at yesterday, and then today we're currently at 683. So we'll see. I think we're right at the top of the curve, already heading down in Italy, which is great. You can see China's already petered down with their death rate. United States, like I mentioned, right at the top of the curve, probably a couple of days, a half a week away, I think, maybe a full week. So we'll continue to keep an eye on it. And then daily deaths are following the same. And then let's look at Germany. Germany was doing really good. They were killing it. So you can see their daily deaths kind of popped up a little bit, but they're right at the top of the curve in like 2 weeks, which is kind of insane. And you can see their daily death rate is actually trending down. So they're right at the top of the curve within the next week as well, which is they're like a week ahead of us. It hit them over a week or two later, and they're already at the top almost. Spain's getting hit pretty hard. You can see they're kind of probably still a week or two away, a week or so away from being at the top of the curve. Their cases are still trending up. And then their deaths, you can see they're following that curve just right. And then here's also South Korea. So look at their cases. They're just going down beautifully. I mean, just right there. Again, this is the gold standard